I will say that Deborah and I have a connection going back many years to a dear friend and colleague by the name of Gary Daffin, who runs a Multicultural AIDS Coalition out of Boston. And way back in the day, I used to work with MAC and did consulting for minority-based AIDS organizations, helping them do capacity building. And logic models, one of the things I helped organizations work on. So in some ways, this feels a little bit like coming home. So let's jump right through. Here's where we're going. Here's where, let me see this. Here's where I hope we're going, right? So we're going to do some brief introductions, talk a little bit about logic models, then we're all going to do one. So get ready. All right, we're going to do it together. And then I'm going to ask you to at least think about it on your own. And depending on how we're set up, we may break out into small groups. And then finally, the debrief and next steps. How does that sound? Is this meeting expectations? Is this okay? Yes? You muted me. It's okay.
I'm unmuting folks, sorry.
That's all right. We're good. All right, so off we go.
Yes, you have a yes in the chat.
Brilliant, thank you. All right, so here's an easy question, right? And here, why are you here? Not meaning why you're here in Central Park with the photo, but why here at this session for logic models? Anything like you thought I'd be entertaining? Is that what you've heard? Well, you've heard right, but is it? Tell me. Yeah,
I have a logic model.
Claire, say it again, and then I'll go to.
Yeah. I have a logic model due for a class on Sunday.
Who's it due for?
Professor Nicholas Groskopf.
Okay.
Yeah, program planning.
Very good. I hope I can help you, Claire.
Yeah, me too.
All right.
Well,
please, yes.
Well, I'm here because the new executive director of my organization suggested that I check it out.
Right. That's a good reason.
That's it.
I can work with you.
I find
Hi,
you
Samantha. How
Yeah.
are you?
Hi. I'm all right. How are you?
I'm groovy.
Yeah. Well, you know, I find you entertaining, of course, but I'm here because I don't actually have formal training in this, and I'd like to obtain some.
All right. Off we go. Anyone else? Anyone else? Going once.
You have a question, you have one in the chat. I want to get a better idea of how to develop them for streamlining public health intervention, development and implementation.
Yep, good, good, good. All right, we're gonna start to get there. This is only an hour, so I don't want to. I kind of want to under promise and over deliver. So we're gonna try. All right. So let's jump to the next slide. I'm trying to see all your faces while I do this slide thing. So off we go. All right. So first, before I dig deeply into logic models, I want to try and position where logic models are vis-a-vis other models. And, you know, of late, we've been hearing lots and lots about different attempts at modeling, right? So we've heard, or many of us will be familiar with conceptual models, right? And what are conceptual models? I have an example here, but what are conceptual models supposed to do? I know, right? Like what's right? Like it's tough. What are conceptual models supposed to do? All right, let me try. So a conceptual model is supposed to take the way we think about something, and it can be a theory or a rationale, and it tries to explain how that theory or rationale impacts something else, right? And in public health, we often think about how theory impacts health and what drives health behaviors among populations, right? Or what drives disease among populations. So we look for a conceptual framework so that we can think about interventions, right? And how to make things better, right? Because we have to have a picture of how something works before we can often get to a place of how do we fix it, right? So conceptual models are one way the field models. What I have here, what I pulled, and I have the citations below, is a conceptual model for the historical legacy of trauma and how that can impact, have a health impact on, have health consequences and impact people's health status generations down the line, right? And then we have systems modeling, and systems modeling has really started, well, it's probably come into its own, but certainly within these last several years. And we've seen a lot of it related to, certainly related to obesity work, to just about every field, but especially during COVID. And what does systems modeling try to do? Okay, systems modeling, anybody? Right, so systems modeling is the next step. It tries to assess what are the factors that contribute to a health condition or a health outcome. But systems modeling really tries to identify the multitude of factors and then gives emphasis to the most prominent factors, right? But systems modeling says, you know, this isn't so simple, right? And systems model is really about trying to map that complexity and then try and identify the major pathways, right? All right, so then we have logic models, right? And some of you are like, so what's left? Like, what is a logic model going to do from it? So I think of logic models as the applied approach. So logic models really try to take us to that place of how we understand relationships within the work our organization is trying to do, and where we can intervene, right? And where we might be able to do that effectively. And lastly, what we need to get there, right? So as you can see from this slide, right, it really brings forward the relationships, resources and activities trying to drive us to outputs and outcomes, and then how it works. First, you know, we have to think about how it should work, and then I'm going to try and take us through a process of what we actually have to make the program work, right? So let's jump to the next slide. Okay. All right, here's the Sean Haley tips to logic models before we jump in and do a logic model, right? So when you look at a logic model, just the template, and Deborah was kind enough to send out the template to everyone, it kind of looks simple, like, that's not so bad, you know? I think Deborah set out the 9-column one. We're going to start easier with the 5-column one, but not so simple. Challenge is once you get in it, you're like, ooh, this is a little tougher than it looks, right? And then you get to the place of after you do it once or twice practicing, like, okay, I got it, not so bad. Challenge is sometimes when we do a logic model, we kind of like, okay, check off the box, right? And I think Claire's got it due for homework assignment. She's like, I need to get it done. You know, but when we're working in a program, we're working for a program in the field, kind of like, okay, did it, now I don't have to think about it again. I'm going to try and encourage you and bring forward why it's important to create or to treat logic models like a living document. And we'll get to that in a minute. But let's keep going. Okay, so why, oops, I'm supposed to ask this question. Why do we use yet logic models? And, you know, I did not grow up in a call and response tradition. That is not Roman Catholic, it's anything but call and response, right? But I really like call and response. So anyone who wants to jump in here, I'm a fan. So why do we use logic models, right? When we're doing program planning or program evaluation?
Isn't it like a central source to map out what an intervention may or may not be from beginning to end,
Yeah,
and what that organization has available to it to use
yeah.
to help along that process?
Yep. So it gets us to here are the resources, right? And here's what we got to do, right? Here's where we want to end up. How do we get there? Keanu, is that fair?
Yeah, I think
All right.
so.
Okay, why else?
It also could serve as a tool for us to check back in to evaluate the success of the program, if we're still doing what we intended to do, if there's anything that we haven't done yet or something we should change.
Karen, exactly right, right? Now, Karen, can I ask you another question?
Yes.
Thank you. Karen, do you work on a team or are you by yourself?
I'm currently a student.
Okay, that's okay. But can I ask you to like project forward, right? Like, time travel forward. When you're in an organization and you're working on a program, do you think you're going to be doing it all alone or with a team?
Probably with a team.
Karen, that is the right answer, right? Even if you didn't believe it, that was the right answer. Okay, so you're probably doing it with a team, right?
Yeah.
And then if you're trying to do a logic model, what happens if you as an individual just say, this is what we should do?
Well, then my teammates may not agree, or they might have their own ideas of things that they want to put into a logic model.
Absolutely. Yeah. And anyone, like, I'm going to ask another question, Karen, you've been superb and you can certainly answer, but I don't want to keep you on the spot. But wait, it's a logic model. It's just logic. Everyone should get how to do this. Everyone should understand that this is the pathway. That's right, right?
Well,
It's more complicated than that.
What do you mean?
I don't know. Go ahead.
Or Keanu, what are you saying? You can't read my mind.
No, it's not so much that. I think of it more along the lines of let's say I work for an organization like the CDC, and my end goal is that in a certain community in New York City, let's say West Brighton and Staten Island, I want to increase vaccination rollout, right? Logic models are much more complicated in that although I can map out the overall trajectory of this intervention, the interaction between the organization's different parts and the community's response to the organization must also be taken into account within that model.
Yeah. So logic models they try and capture lots of moving parts, and rarely do we work as individuals, and we need to bring teams along, right? For how we think something is going to work and function. And logic models are a great way of mapping what we think the processes are. Fair? Okay, so that's where we're going. Stuffing up. Oops, did I get both? Yes, Nietzsche vision language. Good. Okay. All right. So this is borrowed directly from the Kellogg logic model, and I've been using the Kellogg logic model for years and years. In large part because it's simple and effective, right? So in the basic logic, there are just 5 components. Resources, activities, outputs, outcomes, impact, right? All right, so let me see how this, okay. Resources, right? It's the capital, right? It's the human capital, it's the financial, it's the organization capital, community resources, it's everything that it takes to get the job done. Activities are those tasks and that work that you do with the resources. Outputs are the results of those activities. Now, this gets a little tricky, And it takes a minute, right? Because often we want to suggest that outputs, the results of those activities, are the same as outcomes. But they ain't, right? Technical speak, but they ain't, right? Outputs are the results of the activities. Outcome, when you think about outcome, always try and think about that word change, right? So for an outcome, it should be a change in status, right? And in public health, we often talk about a change in health status as the outcome. Are we good? We good? They're clear? Okay, good. All right, so there are the components. Okay, ready? Look, y'all, if you can turn on your camera, that would be tremendously helpful. Again, if you cannot, I'm not sweating you. But if you can, you feel okay. If you now trust me enough, like, okay, he's not going to shame me. Like, we're going to, because here's what I'd like to do. Okay? It's good to see people. All right. It has, here's a question for y'all. It's been a long year. Yes? This COVID thing. I like, it's been a minute. Yes?
Yes, yes.
Right. But some of us have started to get vaccine and we're starting to, get signals that we can spend time with family. So what I thought we would do is plan through a logic model, dinner with family. And this is like, not just like immediate, we're thinking a slightly extended within CDC recommendation of gathering with family. Like, can we do this in a logic model kind of way? Can we do a very quick, like, run you through logic model? So I'm going to give you a template. Like, here's the template. And I'm actually going to come out of this big sheen squaring thing. And so I can type in. Good. Okay. So let's pretend we're all family. Can we do that for the moment? I will not sing that song, I promise you, because many of you will just sign out. But okay, we're going to keep going. Okay. But we are planning a family dinner. Okay. So what are the resources we need for this family dinner? Anybody?
Food.
Food. Groovy. Thank you. What else?
Beverages.
Bevies. Oops. Bevies with a S, not a W. What else?
Utensils?
Location.
Everything's about location, right? Okay, what else? Keep going. These are great.
Equipment for cooking said food.
So what do you mean equipment?
Like stove, ovens.
Okay.
microwaves.
So we need stove, yeah. Pots, pans.
Yeah.
Yeah, that
Electricity.
Ooh, we need
And
power,
water.
right? Ooh, water's a
Basic.
good thing.
Yeah, basic infrastructure.
Yeah. Wait, someone said water. Oops. Oh, okay. Pans didn't come out quite right, but you know what I mean. All right, what else? Anything?
Table chairs.
Oh, table chairs, yeah.
Cheers.
What else?
Napkins.
Napkins. Sleeves are not cute. Okay, what else?
Yes.
Guests. Good. Right?
And we also need hosts.
Hosts. Well, at least
Sanitizer.
one.
Sanitizer.
Oh, Santa. Ooh, look at you. Okay.
You need
So
plates? Plates?
Plates. Thank you, Roseanne. Soap. Someone said soap. Gosh, can you tell we're living in a pandemic? Sanitizer, soap, right? Vaccine cards. Sorry, that's me.
Oh, yeah.
Oh, no, I'm kidding. All right, keep. What else?
Paper towel.
Paper towels. Okay. Is this a good enough list for right now? Are we good?
Yeah.
Like, so,
Yeah.
so we're going to say this is good enough for government work. Okay. So then, what are the activities that we need to do? To prepare this dinner, to like have family over for dinner. What do we need to
Shop for ingredients.
shop? What else?
Invite guests?
Right? Yep. Someone else?
Clean.
Ooh, yeah. Like Karen, you grew up in my house. Like you had no one can come over until that house is spotless because you don't want people to come over and talk about you, right? Like, yeah, we probably grew up in the same household. All right. What else?
Cook.
Cook. What else?
Serve.
Serve. Yeah. What else?
Entertainment.
I'm just gonna put music because
Yeah.
we're gonna go that way. Okay. Very all right.
Yeah. Clean up.
Yeah. Right. Clean up. Yep.
And crowd control, I guess. I mean, I don't want anyone staying over afterwards. Like, I need to.
Uber.
All right. Keanu, is that okay?
Oh, you have to eat.
Ooh, eat. Right. Right. Anything else? And look, we know that there are lots of activities like nested within, right? All of these within shopping.
Yeah.
You know, you've got to figure out, you got to do a grocery list, right? So there are nested stuff within here. We don't have to spend a ton of time, right?
No.
So then what are the outputs? Like, what are the results of doing all of these things in the activities column?
Guests are full.
So full, meaning in the positive way of satiation, right?
Yeah.
Okay, cool. What else?
Happy they're able to socialize.
Okay. So, Rafaela.
Yes.
The meal was served.
Here's where Maria, I'll come back to you in just a second. So, Rafaela, here is where I wonder if that doesn't drop into the outcome column, right? And here's why. You can push back on me, right? Because Rafaela, say it again. You said happy to be able to socialize, right?
Right. Mm-hmm.
That, like, full satiation, like that's a change. But happy to be able to socialize seems like a different kind of a change, right?
Okay.
Does that make sense? Other people agree? What do you think?
Yeah.
Yeah.
Yes.
Like a kind of a different order, right? So full is like the immediate result, right? Like happy to be able to socialize. That's kind of a longer term, longer lasting outcome, right? Okay, so Rafael, I'm going to Rafael, I'm super glad you said it because it's this great example of the tension between output and outcome, right?
Mm-hmm. How about one meal served?
Sure, we could do that.
But that's the output.
Yes.
It feels like the meal served or meal eaten would be the output, and then the outcome would be satiated. But I'm not sure.
Oh, I like that, Marie.
Yeah. Yeah.
Okay. All right. So here's the thing: we put serve under activities. So do you want to get rid of it there? How about here we go. Here's a thought. Let's put that here, this goes here. And then how about meal prepared here? Does that work?
No, meal served.
Oh, yeah.
Meal served. All right.
Meal eaten.
Meal eaten.
Yeah. It's been prepared and served and delivered.
Meal eaten. I like that. That's better. I like that. All right. So it's eaten, and then the result of the meal having been eaten is people are full and satiated, happy to socialize. This is good. What else?
Like if you enjoyed the meal, like meal enjoyed, is that an output or an outcome?
That's an outcome, or maybe an impact on the family, but
yeah.
Underneath outputs, wouldn't you put down the number of family members and guests that they were there? Under the resources, I see guests.
Mm-hmm. Yeah, so we can absolutely say that, right? We can say meal eaten by X number. Yes? Mm-hmm. Is that okay? Now,
we could also say meals prepared or number of dishes prepared.
Oh, I like that, right? So we're getting to we're breaking output down just a little bit more, right?
Oh, good.
Yeah. I have a quick question.
prepared, meals eaten are two separate categories.
Yep.
I'm just wondering, I'm noticing that as we talk more and more about what's included in each column, we wind up, what's what I'm looking for, refining it
Yes.
into more simple and simpler tasks and measurable outcomes. I'm just wondering, at what point do we stop? Like, is there such thing as over refining?
No, it's a beautiful and wonderful question, and I love that you're asking, because when we're refining these outputs, and I like them a lot, and I like this distinction a whole bunch between the outputs and the outcomes. What are those outputs? What are they starting to look like?
Well, there are the actions necessary to achieve the outcome.
Yeah.
The outcome is the change in behavior or attitude.
Right, or health status, right, Linda? Right, this
Okay.
status, right? Okay, but can you also see how the outputs, depending on the specificity, could also double as objectives?
Yeah.
Yeah.
Yes.
This objective measurable, right? So to get to Keanu's point, you can have these broad outputs, right? And then if you get really specific, sometimes you can have those outputs double as your objectives and easier measures.
Yeah.
Because they're the actual results.
Yes. Yep. So
I'm sorry, I didn't mean to interrupt. I'm just also kind of wondering now that, so since like these outcomes are measurable, right? In our preparation of set outcomes, do we also have to think of ways in which they would be measured? And would that have to be included in the logic model? Or does that step come like after?
Yeah, sometimes, so for programmatic logic models, measuring outcomes can be hard, right? So what you're trying to do is create a linear process by which resources plus activities plus the output gets us to these outcomes. If the organization has the capacity to measure the outcome, absolutely, right? That is a wonderful thing, but outcomes are usually longer term, and organizations sometimes don't have those resources.
Yeah, because I was thinking, like, for example, in dinner with family, right? The immediate outcomes would be like meals prepared, amount of like grams of fruit eaten on average, like things like that, right? And then follow up from that initial outcome at the end of that dinner could occur like a week later, and seeing like residual effects of said experience, which could also be data that's collected.
Yeah, and here's, much as you have to, and here's where I really want to be clear. Organizations will define that line between outcomes and outcomes a little differently. Right? Much the same way an organization will define the dividing line between an outcome and an impact a little differently, right? To kind of where you began to go, some organizations might say that impact, that happened, that sensation that happens a week later might be an impact about family gathering, right? Like you get a little nostalgic and wish you were with family again, right? Or you're reminded about how important it is to be able to hug family members. Not that we're all going to hug each other. Like I know we said, but those sorts of longer term impacts, right?
May I ask a question?
Of course.
So I'm wondering, is this an outcome? Uncle Harry was invited but refused to come and called during the dinner because he doesn't believe in the vaccine.
Yeah, so I'm not exactly sure where to put it. That might be an activity because someone's got to manage that phone call, right? When it comes in, I don't think it's an output or an outcome. I think it's an activity.
It's an activity, but it's also a report. It's an output that comes during the process, because we invited 20, 7 showed up, 1 didn't respond, and 2 don't believe in getting a vaccine.
I can hear that. I can hear that as an argument for an output, right? Like as when framed as a report out around
It's not
invitee
an outcome, but it's an output. Yeah.
Yep, around invitee status. I can see that as an output, sure. All right. And so let's just can we get something in this impact box? Just because, you know, you know, but not that I have a diagnosis of OCD, but I'm feeling it a little bit. So I'm kind of feeling like we should put something in this box, right? Can we put something there? What would you give as an impact? Like longer, a week away. What's an impact?
People feel more connected, maybe.
I like that.
Feeling connected. Yeah.
How's that? Good? Good enough for government? It's not. All right, y'all, what is, and I'm trying to be mindful of time. So if I feel like I'm
Okay. Some of the invitees decide to have dinner parties.
Sure, that's good. I'm just not going to type it right now, but I think it's great. I'm just trying to jump to the next, okay? So y'all, when you look at this, right, how does it seem? Does that seem like, okay, this is reasonable? It makes sense? Like you look at it like, okay, I can follow that. Anyone not? So when we think about, and I'll go to a bigger screen here in a minute, right? Was there anything that was clear or unclear or confusing? Anything that was unclear or confusing? Okay, so here is the good news, y'all. Y'all have just done a logic model. How was that?
Good.
Like,
Yeah,
some of
easy.
you, like, if I wasn't on video, I'd do a happy dance for you, but you know, you asked me to be on video, so now we're happy. Okay, so good. All right, so what I'd like to do now is going to, I need some coaching from the group here, right? Because what I wasn't so sure about, and we're never quite sure with these things, is if folks signed up from the same organization, or if you're from different organizations. And what I was going to do is, if you were from same organizations, and suggest that we break into teams to just begin this process of actually starting a logic model for a particular program. Given the number of folks, and I'm not sure folks are in teams, I could also think about just having us talk through this and jump to the next. Tell me what works for you. Tell me what would work for all of you. So
I would like to do it in a group as we are now.
keep it going. Okay.
Yeah.
Sounds good. A couple people are nodding. Great. All right. So let's do that. So what do you see? Like, I've changed it up, right? So wait, you saw what I did to the top, your title? You just put whatever the program is, drop that in, right? And this can be a program logic model, okay? What did I change up on y'all? I changed a few things.
Yeah. You added statement of the problem.
Yep. What else?
Assumptions.
Needs
Okay.
assessment.
Yeah, needs it, right? What else? One other thing.
Resources.
Well, yeah, resources are the same, but there's something next to it, right?
Needs assessments.
No,
Needs
need and
assessment?
have.
Need and have. All right.
Hmm.
Exactly right. So let's take these. Why did I look? You're all like, Sean Haley, you just took us through a logic model. We're feeling good about it, and now you switch it up on us. What are you doing to us, right?
Finding it.
Well, trying to get you to make it a little bit more specific, right? So we did a really good generic logic model, and that is like education 101, like grab the low-hanging fruit, give people the confidence, right? And now you're like, I am a super person, I can do a logic model. Yes, you can. And now we're gonna try and make it mean something. All right. So statement of the problem for a program, right? Why why is it important to begin with a statement of the problem for your logic model? It's really important in organizations. Why?
Because you need to know why you're doing what you're doing.
Yeah, absolutely. You need to know why you're doing what you're doing. And how easy is it to come up with a statement of the problem within an organization?
Not.
So easy.
Not easy at all.
Hard, right? But if you don't have a clear statement of the problem and people are not agreeing on the statement of the problem, how the heck? I think I'm being recorded, so I'm going with heck. Deborah, am I being recorded?
No, oh, yes.
She's nodding yes.
Yeah.
No.
Yeah.
Why the heck? Like, how the heck do you design an intervention that's going to be effective if people can't even agree what the problem is? Right? Statement of the problem first. You with me?
Yep.
Okay. And then the assessment. Why? Why? Oh, sorry. Scratch. Pause. Back up.
Assumptions.
Assumptions about the problem. Why assumptions about the problem?
I came to the party late, so you'll forgive me. But if you're unclear about assumptions that were used to identify the problem, then you can't possibly know the mindset of the stakeholders at the table.
Absolutely.
So it needs to be articulated.
Yeah, right. Because what you're trying to draw out, Linda, is you're trying to draw out how people are thinking about the problem and go exactly as you said, make it from that implicit, and one of the earlier slides, like, we are not mind readers. We may get there with nanotechnology down the road, not so distant future, right? We are not there yet, right? So to unpack the assumptions, and by making those explicit, we can have those challenged, right? In a way that's constructive, like, okay, tell me how you're thinking about that, right? Right. So the statement of the problem and then the assumptions about the problem. And in a healthy organization or in a healthy program, there's a bunch of back and forth about this.
Yeah.
Right. Or, the other thing that happens is people have been working together so long, they just like speak each other's speak and it just flows, which is good and fine. But in lots of places, it's really healthy to have respectful give and takes around these conversations because it's hard, right? It's really hard. Okay. And then we come to the needs assessment, right? And what would the needs assessment look like?
Well, you need to solve your problem.
Okay. But what would that information, Roseanne, what would that information look like? What does needs assessment information look like?
Is it,
Go ahead.
well, is it too old fashioned to bring up focus groups or surveys?
No, that's all part. So the information that comes from the focus groups, information that maybe came from a community survey, that's all good.
Literature search?
Literature search about, the issue, if it's disease or, something else. Yep. What else?
You could use statistics and data to back up.
Data about, and Roseanne, just to drill, so you drill down a bit, right? You can use data about the disease or the injury or the condition you're interested in.
Right.
And also use data about the community, right?
Right.
Yeah. I guess I would phrase it as primary and secondary data specific to those who are impacted, the community, and what it needs to the broader overall well-being of that geographic area or community. So it's got levels to it.
Right.
But it's very important that the needs assessment address the two columns beforehand, I would think.
Absolutely.
Whatever your assumptions are, don't assume what the data will tell you, go find it. But also, is your assessment really reflective of what the group believes is the problem?
Yeah.
Of
So
course,
So multiple data sources, right? Multiple methodologies, right? Using just one data source, especially for community intervention, is often not a great idea. right? So you want to try and get multiple sources. And then, there's an iterative process. Here's what the data from the needs assessment tells us about our assumptions.
Yeah.
Right? All right, let's refine that statement of the problem, right? So you get all that done, right? Are we good so far? Have I lost anyone? We're good? We're good? This all makes sense? Okay. Whew. So then we finally get to the familiar part of the logic model, right? And resources, like, okay, we got that. Like, we were going grocery shopping, we were cleaning the house, we got this, we know what resources are, right? All right, but then I added something. All right. What did I add?
Need and have.
Need and have, right? Why? Like, you're like, Sean Haley, stop making things complicated. Like, why did you add a column with need and have?
Well,
It's like your grocery list, you might have
anyway,
olive
because
oil and
you
pasta in the house, but you need to go get tomatoes and something else.
Yeah.
Right.
Did you hear what Maria said, y'all? She's like, it's like your grocery list. How many of you have like 5 cans of the same spice? Not that I do. Oh my God, if I get one more thing of sage. I never use sage, but if I get one more thing, right? So yeah, it's like, what do you have and what do you need? It's the same thing, right? I don't know that I have that many sage. It's just what came to me, right? Okay, so, right, what happens? And now, I'm being, trying to be a little like funny while I do this, but seriously, what happens in a group process when you begin to identify resources? Have you all done this? What happens?
Oh, yeah.
What happens?
You need money.
Yeah, but to say more, like what happens in a group process when you begin to identify resources?
Sometimes you realize there's more available than you thought.
Yeah.
Yep, there's that. Yep.
But you also realize that your perception is mine versus ours. And if it's committed to the group, then there's ways to get that input, because resources are inputs. They're personnel, their money, their time.
Yeah.
It can be this broad range of things.
Yeah, Linda, you're right. I think that builds on what Marie was saying, that sometimes you realize when you combine folks, you're more than, it's like the stone soup, for those of you that know the stone soup fable, right? I really just dated myself, but that's okay. So the other thing that we sometimes, that I think you're right, like we can identify resources that we didn't know we had access to. I don't know about the rest of you, but I have been in more, I almost said the word bloody, but because I'm being recorded, I wouldn't say that. I've been in more meetings where people just list off the resources as though we had them, or as though they were concrete and we had access to them, right? Where they're not guaranteed, and it becomes this aspirational process. And then you get to the activities, right? And so, you kind of push back on resources, but then when you get to the list of activities, folks are listing all the things that we should do without any connection to what we really have by way of resources, right? And that, it is a hard conversation to have in a group that says, where do you, for this activity, what are the resources that you predict we are going to need to deliver this activity, right? Because people want to get to that, let's get to output and outcome. And it's a hard conversation to try and keep people connected to the activities and the resources that you have.
So if I understand this correctly, it's really a way of figuring out like our own limitations and what is feasible.
I know it's about limitations for sure. It's also trying to keep people honest in a group conversation, because sometimes it's hard to have those harder conversations. And then, to Marie and Linda's point, in other ways, it's like, oh, we actually can do this because we have access to these resources. So it's bi-directional, right? So it can happen in either way.
Thinking of it, I may be wrong, Sean, but I keep thinking of it, and I think I'm borrowing from Marie, as a recipe. I want to make this very good thing. And I go through to see what I have sitting in my pantry. And I check what I have. And by doing that, I immediately identify the things that I personally don't have. And if I'm the sole cook, then I got to go buy. But if I'm part of a group who's doing the cooking, we check with whether or not the other members have, and you cobble together whether or not you have capacity or you now need to identify capacity in order to get liftoff.
Yeah, for sure, right? The challenge that I've experienced, and I'll tell you, like within the School of Public Health, there is, there's always this, and it's not unique to the School of Public Health, but sometimes there's this push to, we should do this, right? And without like full mindfulness about, do we have the resources, the staff, the money, and everything else it takes to get us there? Might be a good idea, but how do we, like, and so that checklist there is just trying to keep people connected, right? Then we get to our activities, which we're familiar with, the outputs, the outcomes, and the impact, right? So once you get past that checklist, right, it's pretty similar, right? And you work the process through much the same way we worked through the dinner example. It takes a lot longer, right? Trust me, it takes a bunch longer, right? And to have this be a thorough conversation, it should take time within a program and within staff to really draw it out. The really terrific thing that I've experienced is when you do a thorough logic model and people can physically see it, there's this aha, I got it, right? Like, okay, now I get why we're doing what we're doing and where all the pieces fit. So it's a terrific team building exercise. Here, I want that to flip. Did it flip? Okay. So when I'm leading a logic model process or development of a logic model, I have a bike stand. Do you know what a bike stand is? That's me trying to be the green version of a parking lot, right? So I try and have a bike stand. And that's for all of the stuff, for the concerns that people raise for the process. Like, wait, I'm not sure we have that, or I don't think we could do this, or what would happen if we did this instead of that, right? And instead of losing those conversations, I will have on a laptop, usually a pad, because I don't like a screen in the way of people. I will have a pad and I'll write down these thoughts and these concerns, right? And then when we're done with if there's not time in the logic model development process, or it doesn't seem like a major issue, like I may not bring it up. It seems like a pretty major issue in the middle of the process. I'll say, that seems like a major issue. Let's talk about it, right? And I tackle it right then and there, because you don't want to keep pushing through a logic model if there's something that's gotten in the way that just makes no sense, right? Because then you're going to design a faulty logic model. That's no good. Don't waste my time. Don't waste my time. Okay. And then at the end, when we think we've got a good draft, I will ask folks directly, are there any concerns? Are there about the feasibility, the scope, or the timing of what we just designed? Right. Again, once finished, I'll ask again. Why do I ask directly? Both throughout the process and at the end. Why am I asking? There are two major reasons why I ask. The first is, don't waste my time. Like, let's identify the problems as we're going, because to design this and not address those problems it's not what any of us are here for. The other is a management reason. If you begin to roll out this project and you find resistance from staff, right? You have a vehicle by which to say, we designed this together. What's getting in the way? All right. So you have a way to do a cognitive check to see if they're disagreeing because they don't agree in what's been designed and developed, or if there's something else happening, or if it's a performance issue or something else, right? And then if they say, well, I don't agree, you know, it doesn't solve the problem, but it gives you a little bit of leverage to say, but why didn't you say anything then? Or you did, and I thought we addressed it. Did we not address it? Right? So from a management perspective, as well as from a program implementation perspective, it can be really helpful to just circle back that way. Deborah, how are we doing on time?
It is 12:54, so.
How's this?
yes.
And we are on my very last slide. So what would be how's that, Deborah? Well,
That's
you're gonna ship me that gold star, right?
Definitely. I'm
what-
putting the survey into the chat, so if folks would be so kind as Sean is finishing up, we'll make sure that we get these slides out to everyone also.
So y'all tell me what would be helpful. So I can get the slides out. In the slide deck, you have the template, you have like the basic one, right? And then you have the more evolved one. And again, I've adapted almost all of this from the Kellogg Foundation. And there's a lot of detail there that I just think is more than you need. But what would be helpful for me? Questions for me? What's helpful? Has this been helpful? Has it moved you a lot?
Yes, it's been helpful. Very, thank you.
Very helpful. Thank you.
Great.
All right. So Deborah has my email. Actually, why don't I just do this because this is easier. I'm gonna do this. Oops. Here. So here is my email. I should have had it on the last slide. sph.cuny.edu. If you have questions, please, by all means, send me an email. Okay.
I want to take this opportunity to thank you again, Sean. I learned something from this. It is always helpful. I thank everyone for coming. Again, if you would please fill out the survey in the link, I'll be happy to share the recording and the slides. Also, you'll find in the chat is our next webinar series, along with a survey that we are doing as a part of the School of Public Health called Harlem Strong, which is a mental health initiative. So I just want to say thank you again. And if there are any questions that we didn't cover, please feel free to respond to the email that I'll be sending out later this afternoon. And again, thank you so much, Sean, for taking the time to explain logic models to us. Hopefully we can get him to come back to do part 2. So make sure you put that in the evaluations. Thank you again.
Nicely done, Deborah. Nicely done.
I'm going to hang out so that anybody can copy any of the links in the chat. Please feel free to do that. And thanks again, Sean, and everyone for joining us today.
Pleasure. Thank you all.